Have you ever heard that filler will make you look fake and overdone? My name is Lacey. I'm an injector at Rejuvn8 Aesthetics in upstate New York, and I'm here today to bust some myths about facial fillers. Myth number 1, filler is painful. The fact is, most of our filler is actually already pre-mixed with lidocaine, making it a lot more comfortable than you might think. Most patients describe it as a 2 or a 3 out of 10. It's very common to feel pressure more so than pain. Hyaluronic acid fillers are considered very safe when administered by a trained professional. This is because hyaluronic acid is a naturally occurring substance in the body, meaning allergic reactions are very, very rare. The procedure is minimally invasive, usually taking 15 to 45 minutes depending on the area that we're treating. Downtime is minimal. Some patients do experience redness, swelling, and bruising, but this usually resolves within a week. Myth number 2, filler stretches your skin permanently. Actually, filler is designed to integrate with your tissue and gradually break down over time. In the event that we had to dissolve it, it may dissolve some of your natural hyaluronic acid. However, this usually resolves within 6 months. Actually, filler can help stimulate collagen production over time, improving your skin's quality and structure. Myth number 3, once you start, you have to get filler forever. This is not true. In the event that you get filler once and then never get it again, it will just naturally break down over the next 9 to 12 months and you'll end up back at the same place that you started. A unique advantage to using hyaluronic acid-based fillers is reversibility. If necessary for whatever reason, including overcorrection, asymmetry, or rare adverse effects, we can use the hyaluronidase very safely to dissolve the filler. Myth number 4. You'll see full results immediately. Results are somewhat immediate, however, results always continue to improve as the filler settles within the tissue and swelling and bruising subsides. Myth number 5, filler will address all of your aesthetic concerns. Filler is a tool in our aesthetic toolbox. When combined with great skincare, skin treatments, and potentially neuromodulators, you can get a better result than if you use filler alone. Filler should be used in combination with potentially neuromodulators, a good skincare routine, and skin treatments. You'll get a much better result than if you just use filler alone. Myth number 6, you can't reverse filler. Not true. Most fillers today are made with hyaluronic acid and can be reversed with an enzyme called hyaluronidase, making them safe and reversible if needed, which is a major reason why we prefer them. Myth number 7, filler can lift the face significantly. False. Filler can provide a subtle lift by restoring lost volume, but it's not a substitute for a surgical facelift, which addresses deeper structural issues. Myth number 8, once your filler wears off, you'll look worse than you did before you had anything done. Not true. You won't look worse, you'll simply go back to the way you looked before you had any filler done in the first place. The only time you may see a small difference is if you have to have your filler dissolved. Sometimes when we use the hyaluronidase to dissolve filler, it can also take a small amount of your own natural hyaluronic acid. This usually resolves within 6 months. Myth number 9, filler is only for aging people. This is also not true. Filler is great for restoring lost volume, but it's not the only time it's useful. It's also great for improving facial contour. Actually super versatile. Some common areas that we treat are the temples, nasolabial folds, jawline, lips, chin, marionette lines, and a few others, of course. And finally, myth number 10, filler will make me look fake or overdone. When administered by an experienced injector, HA filler can enhance facial features and correct age-related changes without looking fake or overdone. Once injected, hyaluronic acid instantly attracts and binds to water molecules in that area. This helps to lift and smooth the skin from within, giving a refreshed and youthful appearance. Hyaluronic acid fillers carry different properties. Thickness, cohesivity, and elasticity all play a role in how we determine what filler to use in what body part. We need to pay attention to how much that area moves and also how much structure we need in that particular area of the face. We also love hyaluronic acid-based fillers because it's completely customizable to your unique facial anatomy. The bottom line is we love hyaluronic acid-based fillers because it's quick, minimally invasive, reversible, and safe. Filler doesn't need to change your unique features, but it should enhance them. Filler can be administered with either needle or a cannula. We do both at Rejuvn8, however, a lot of the time we will use cannula. If you're interested in filler and think it might be the right choice for you, book a consultation at any of our Rejuvn8 locations and we can give you a full facial assessment.